I now recognize the gentleman from Michigan, Mr. Kildee, for 5 minutes.
Thank you, Mr. Chairman. Mr. Secretary, it's always good to see you. Thank you. Good to have you back.
Thank you.
And thanks for being here. I was really pleased to see in the proposed budget regarding the Indian Health Service a change that we've been long advocating for. The federal government, as we know, has a trust responsibility to ensure uninterrupted health access for tribal communities. It's something that you and I worked together on when you were here in Congress. Currently, the Indian Health Service is funded differently than other health programs, as you know, like the VA, for example. This unequal treatment means that access to health care is often at risk in the event of a government shutdown. And of course, this is not a hypothetical situation. When the government partially shut down from 2018 to 2019, the staff employed at the Indian Health Service clinics had to work without pay, and important preventive tribal health programs were forced to stop. And that's just not right. As a member of this committee, I've been advocating for some time for parity between IHS and other federal health programs. And I thank the chairman, I obviously thank President Biden and yourself for including this initiative in the annual budget, and I'm committed to working with the administration to get this fixed. And I wonder if you can perhaps address how important permanent funding that is not subject to the whims of congressional action and being suspended by a shutdown could have an impact on tribes that deliver services, tribes like the Saginaw Chippewa tribe that I represent, and particularly if you just might address how this initiative and others might help address care for tribal communities.
Congressman, first, thank you for your leadership on this issue for so long. I think you mentioned it. I think we feel we have a moral obligation to help our veterans. We have a moral obligation to help seniors who have contributed to the Medicare program. We have a moral obligation to our children to make sure that they can grow up healthy, and we provide the CHIP program for them, Medicaid. We not only have a moral obligation to our tribal communities, we have a constitutional obligation. It is in the Constitution. And in the treaties that we've signed, we have a trust obligation to do these things, yet we've never done it. And it's high time we do. And it's been, as I said, a moral failure on the part of the nation to not recognize it. Perhaps because the Native American population is so small, some people can ignore it, but we shouldn't, because we're talking about the health of human beings, our brothers and sisters. And so I am proud that President Biden is the first president to step forward and say, it's time to recognize not just our moral obligation, but our constitutional and legal obligation to Indian country to do what we should have been doing a long time ago for these tribal nations.
Well, I thank you for that, and I know you worked with and served with my late uncle Dale Kildee, who actually once served as a member of this committee as well, and this was part of his life's work. And so the fact that we're in now a position to see this action taken, I think, is in many ways a testament to his long work in this subject. So I thank you for that.
Amen.
Another subject that I've been working on and spending a great deal of time on has to do with the access to affordable clean water. We all know what took place in my hometown of Flint, Michigan. If it were only just an anomaly and not a warning to the rest of the country, it would be sad enough, but it really is just a warning. The problem that we have, though, is in many of the communities like my hometown, water is really expensive. An average family in Flint pays $864 a year for water. Some people pay into the thousands of dollars a year for drinking water. So I was happy that we were able to work together to form the Low-Income Housing Household Water Assistance Program, secured $1 billion for that effort. The program is making a difference, but it's set to expire at the end of 2023, and water is not going to suddenly become affordable at the end of 2023 in many of those communities. And I wonder if you might just discuss your thoughts on the Low-Income Housing Water Assistance Program, what it means for places like Flint, Saginaw, Bay City, and others, and what the administration hopes to do in extending funding for this really important water assistance program.
Congressman, the president's budget proposes to build on that program because it's so essential. I can point to communities in California where they can't open the tap anymore because water will either not flow or it's too dangerous to drink. And so it's the same, whether it's at Flint or in some town in California or throughout the country. No one in America in the 21st century should not be able to open the tap and be able to drink the water. It's incredible in the richest nation in the world that we're talking about this. That's why the president has decided we're going to invest in this and work with you. So I hope that you continue to champion this because it's just the right thing to do. We should be able to take for granted that we're going to have safe drinking water for our kids.
Well, thank you so much, Mr. Secretary. I appreciate those answers. I appreciate your presence here and your great work. And I yield back, Mr. Chairman.
Gentleman's time has expired. I now yield the gentleman from Texas, Dr. Burgess, 5 minutes.
Thank you, Mr. Chairman. Mr. Secretary, thanks for being here today. Thanks for being in person. We love virtual hearings, but this is much better.